So it is the very last session of Allied Health Week. We have had 9 sessions already this week. We're super excited to be partnering with Horizon to offer these opportunities for the students to understand the different career pathways in allied health and to speak to some of the experts that work in our system. So my name is Deneen Diamond. I'm the lead for the Center of Excellence for Health. And again, just very excited to have the teachers and students here to listen to the beautiful presentation. We've saved the best for last, medical radiation technologist. And without further ado, I'm just going to introduce our guest panel. So Mackenzie McKnight, she's going to share her path from high school student to university graduate to working technologist. Mackenzie will share her love of working in this dynamic field, both within the hospital environment and at a private chiropractic clinic. Additionally, through a 5-minute video, Tracy Hale will provide an overview of the Bachelor of Health Science Radiography program offered through the University of New Brunswick St. John and the Moncton Hospital School of Radiology. The video will include a tour and the Moncton Hospital Medical Imaging Department and a short Q&A with current radiology students. So very excited to have both of these experts with us. I want to say thank you right up front for taking time out of your busy day. I know how busy everybody is. And also welcome to the beautiful students. I'm just going to look in the chat really quickly. We have Miramichi Valley. We have beautiful PDCB students in Miramichi Valley. That's with Madame Malti Ingersoll. We also have Miss McKinnon, and she has 2 students from the grade 12 ICE program. And we also have, let me just see here, our wonderful #1 guidance counselor from St. Malachy's. We have a teacher here that's been coming to each session, and I don't see her on the list, right? Oh, there she is, Miss Krapp. So she has students here as well. So without further ado, I'm going to turn it over to our guest speakers, and really excited to hear from you both.
Okay, so hopefully you guys can see my screen. My name is Mackenzie, and I am just going to be talking to you guys about how you would become a medical radiation technologist or an MRT. So before we get too far into this presentation, I just want you guys to know exactly what it is that I do for a living, because some of you may not know what MRTs do by name, but you'd certainly know them by what we do. So MRT, as I said, stands for Medical Radiation Technologist, but we also answer to radiographer, diagnostic imaging technologist, or more commonly, X-ray tech. So I'm an X-ray tech. And for educational purposes only, an MRT is not the same as a radiologist. That's the doctor who reads all the exams that we perform. And we are not a technician, and there is a difference. And we aren't a nurse that specializes in X-rays. We are our own individualized program, association, and job. So just what we'll be talking about in the next 25-ish minutes. Be starting off a little bit about me and how I got here, my career portfolio, some education and training that I needed to get to where I am, as well as continuing to do. And then finishing off with a day in my life as an X-ray tech and some career advice. So, a little bit about me. My name is Mackenzie McKnight. I am 23 years young, and I'm a licensed medical radiation technologist. So I'm originally from Salisbury, New Brunswick. I graduated from JMA in 2016, and I currently work at the Moncton Hospital, the Sackville Memorial Hospital, as well as DuPa Chiropractic Clinic as an X-ray tech, and that clinic is a private clinic in Booktbush. Fun fact about me is that I have 2 adorable cats. The black one, his name is Wilhelm Runken, and that's he's named after the man who discovered X-rays in 1895. We call him Willie, though. And then the other gray cat, his name is. So how did I get to be where I am today? I'm so glad you asked. When I was in grade 12, I just had no idea what I wanted to do with my life. I hadn't applied for any college applications, and I was months away from graduation, where most of my friends knew exactly where they wanted to be in the next 5 years. And if that's you right now, fantastic. But at this point, I didn't even know that this profession existed, much like probably you guys listening right now. So one day at school, we went to this career fair at the Moncton Hospital, and as soon as you walked in the doors, the first booth on the left, I can see it now, was Tracy Hale, who will be speaking with you guys later on. She's also the program director for the X-ray school here in Moncton. And I had a chat with her and her colleague Pam, and I just knew right away that that was something that I really wanted to do. So I took their brochure with me the next day to school, and I went to see my guidance counselor, and I said, hey, I need to get into this program. What do I need to do first? And basically, step one was making sure that I had the right courses I needed to get into university. And unfortunately, I did not. So I had two options. Basically, I could go back to the drawing board, find something else I wanted to do, or I could go back to high school and do an upgrade year after I graduated, and be behind a year. And because nobody's path is the same, and so what if you had to take a few more courses? I graduated from high school in 2016, knowing I'd be going back to high school the next year. So in 2017, I went to Petitcodiac Regional School to do a couple more courses that I needed to get into a Bachelor of Health Science at UMBSJ. That October, UMBSJ was actually having an open house where you could apply into your program and get an acceptance letter on the spot. So my friend and I drove up and did just that. And judging from that picture in the bottom right of your screen, it looks like I got in. However, I did not. What I didn't realize is that I specifically needed a physics course, and I didn't have it. I had bio and chem. So I wasn't eligible for a Bachelor of Health Science. I was eligible for a Bachelor of Science. So I took what I could get. And knowing that a science degree wasn't going to get me into X-ray school, I went back to school the next day. I enrolled in a physics course, and with a passing mark in physics that December, I was finally admitted into the Bachelor of Health Science at UMBSJ. Step one, done. So after 2 years in St. John, I was then accepted into the Moncton Hospital School of Radiologic Technology, where I completed 2 years of focused learning in the X-ray department itself at the Moncton Hospital. And even through a pandemic, I graduated in May 2021 with a Bachelor of Health Science, a major in radiography, and a certificate to practice with ionizing radiation anywhere in Canada. So, since I graduated just over a year and a half ago, I started working casually at the Moncton Hospital as well as the Sackville Memorial Hospital. That way, I get the best of both worlds with the variety involved in a larger hospital, as well as the opportunity to improve your critical thinking skills with the smaller hospital. The mission statement for Horizon Health Network is helping people be healthy, which is definitely something that I can resonate with. This past summer, I also started working at one of the busiest chiropractic clinics in the province, and it has been one of the most rewarding experiences of my career so far. The mission statement for Dupal Chiropractic is restore health to those who have lost it and help preserve health to those who have it, which is something that I've witnessed the incredible chiropractic doctors execute firsthand. So one of the many benefits of this profession are the different modalities or areas that you're qualified to work in right out of school. So these are just a few examples of the areas that we can work in, and I'm just going to do a brief overview of basically what they all entail. So general radiography, we also call Gen Rad. It's kind of a one-size-fits-all area. It includes all the different areas to work within its own modality, including the emergency room, the operating room, and many more. If you've ever had a CAT scan before, it's that machine that looks like a giant donut, and you lay on the table and go in and out a couple times. So it was an MRT that performed your exam. We're also qualified to do mammograms as well as bone densitometry scans. As well, we do many interventional radiology procedures. I'll talk a little bit more about that later. And finally, there's a bunch of different leadership roles that you can grow into as your career progresses. So starting off, I'm just going to break down each area like I had mentioned, so you can really get a feel for what MRTs do. There's a lot. I'm just going to highlight a few. So starting with Gen Rad, the Gen Rad techs are the people that perform all the outpatient exams and x-rays. So when your family doctor, for example, orders an x-ray of your knees, you would come to the x-ray department and an MRT will perform that exam for you. So this is an example of a chest x-ray being performed. MRTs are also people you would see in the emergency room doing your portable x-ray when you fell off your bike, for example, and hurt your arm. We also take our portable machine up on the floors and do x-rays on all our inpatients for patients who aren't stable enough to come down to us. And this may come as a surprise to you because I know it did for me when I first started my schooling, but Gen Rad techs also go to the operating room to perform portable exams, as well as fluoroscopy exams, which is live x-rays that are continuously going at a lower dose to create kind of like a video. And I have an example of that. The video works. Great, so this is a picture of someone who broke their arm. This is after their surgery. They had a plate and a couple screws put in on that arm. And if you're wondering why they use x-rays in the OR for that, this is just a great example. So these are x-rays that are continuously running at that lower dose so that the surgeon can see the plate if it's in the right spot on the arm there. Yeah. So this is what our fluoroscopy room looks like in the x-ray department. We use this room to perform joint injections like for the hip or the shoulder. And we also do exams involving the GI tract to see our esophagus, our stomach, as well as we can do some to see the colon. So this is an example of what we would see while doing an exam to look at someone's esophagus. And that's called a barium swallow. So we do these quite often. Yeah. And so we also have a few fluoroscopy rooms in some clinics. So we do an exam called an ERCP, and this is to see someone's bile ducts in the liver, gallbladder, pancreas. You would have this exam done if you had gallstones. We also do have a fluoro room to do some urology exams, which involves your urinary system, like your kidneys and your bladder. The next modality or area that you can practice in right out of school is computed tomography or CT. And this is better known as CAT scan. So basically, a CAT scan is a series of x-rays that are taken from many different angles to produce a cross-sectional image of the bones and organs in your body. Kind of like when you take a loaf of bread, you can just see the outside, like the crust. So that would be like your skin that we can see. But if you slice that bread up, you can see all the different air bubbles inside the loaf. And if someone were to bake a coin into the loaf of bread, like the picture on the top left, you wouldn't be able to see it unless you cut thin slices into it. So if we were to take those same principles and apply them to someone's head on the x-ray, you just see the skull. But if you take a CAT scan of someone's head, then you can see inside the brain. So this is just a video of what a normal CT would look like from the very top of your head, and it goes down to your pelvis. So this is completely normal. You can see all the different things in your head, like your brain. It'll work its way down. You'll get to see some of the aspects of your neck. And then we can also see things in your chest, like your lungs, heart, and then in your abdomen, we can see things like your liver, your stomach, your kidneys, your pancreas, your colon, those things. And then as it makes its way down into the bladder, you can see, the pelvis, you can see things like your bladder. And you also can see all that bony structure, like your spine, your ribs, as well as all the different blood vessels. So that's pretty cool. So this is what our newest CT scanner looks like on the left, and on the right is a picture of what our control panel looks like, where we can do all that processing of the images. So next up is mammography and bone density, which are done by cross-trained MRTs. So one day they could be doing a mammogram, and the next day they'll be doing those bone density scans. So this is what the mammography and bone density rooms look like at the Moncton Hospital. So mammography consists of screening mammography and diagnostic mammography. These exams are performed on individuals for the purpose of ruling out breast cancer. Screening is done for patients who are average risk and done on a regular basis, where diagnostic mammograms are done as a callback from the screening to perform specific images to better see some of the breast tissue. Typically, mammograms are done for patients 50 to 75 and not recommended for those younger than 40. And bone density exams are done to measure the overall bone health of a person to determine if your bones are more fragile, which is a disease called osteoporosis, and may be more susceptible to fractures in the future. And this is typically only done on patients 65 and older. So next up, we'll talk about some interventional radiology area. So MRTs also work side by side along interventional radiologists, who are the doctors, to perform many minimally invasive therapies under X-ray guidance. So this is an example of an MRT. This is Tammy. She works in IR at the Moncton Hospital. So she's setting up a sterile tray before the patient comes in to start the procedure with the doctor. And last but certainly not least, there are many different leadership roles that you can grow into as your career progresses. These roles can be done independently as well as alongside your job on the floor. So we currently have 4 amazing instructors at the school. We have Daphne and Becky as the clinical instructors, and Tracy and Pam as the in-class instructors. Plus Tracy has that dual role of being the program director at the school as well. We have numerous supervisors in the department that help ensure things run smoothly. And there's also a lot of opportunities to work in the provincial and national association. So Jen Carey, she is the former president of the CIMRT and the current provincial manager of the CIMRT Atlantic, and definitely one of my personal career role models. Jessica is the vice president for the Provincial Association, the NBAMRT, and Ashley on the far right is the president of our Provincial Association as well. And I've had the pleasure of being taught by and working alongside all of these fantastic ladies, and they're definitely people that I look up to. So if you're sitting there saying, oh my goodness, Mackenzie, this is fantastic. I definitely want to do this. How do I do it while staying in the province? I have great news for you. Here's a step-by-step how you would do that. So starting off on your far left, these are courses that you would want to take in grade 11 or 12, and making sure that you have a minimum of 75%. You would then apply to UMBSJ. 6 months into your first year of university, you can apply for your major. And in this case, you would apply for a major in radiography, and making sure that you have that minimum grade of C. You can either be accepted into the Moncton program or the St. John program. And after that, you'd start your dedicated schooling at that hospital of your choice. After successful completion of your 4th year, you'll graduate university with your Bachelor of Health Science and your major in radiography, which allows you to gain access to write your certification exam, which is what gives you that credential of RTR after your name. And once you pass your certification exam, then congratulations, you're a medical radiation technologist. And one of the requirements to maintain your certification is you're required to complete your continuing education credits per year to ensure that you stay current in the technology in the field. So for me, I'm currently doing my CT certificate through the CIMRT, and then I get to add a fancy CTIC after my name too. So if you're interested in pursuing this career in anywhere else in Canada, there's many different other schools that offer this program, and this is just a list of all of those areas. So for a day in the life of a general radiology MRT, I should start off by saying that every day in the medical imaging department is different and unique in its own way, as I'm sure you can imagine. But there are some things that we do pretty routinely every day, so that's what I'll be describing to you. And it's important to remember that because there's so many different areas that you can work in just in Gen Rad. We're put on this rotation or a schedule in all those different areas like the ER, the OR, depending on where you are scheduled for that day. This rotation is really nice if you get bored easily, and it also allows you to keep up your skills in all those different areas. So many things happen at the beginning of the day, each day. So first thing around 6:45, all the x-ray tubes in the department, the OR, and the clinics need to be turned on if they were shut off overnight, as well as they need to be warmed up. We also have checklists for each room that we do in the morning so that we know that we have everything we need for that day. So if you're scheduled in that room, you'll make sure that you've done your checklist. At 8 a.m., the two people who are designated to do those inpatient portables will leave for the day to go do those. For people whose doctors ordered an x-ray the night before. Usually around 8:30, we'll have those fluoroscopy exams start, with whichever radiologist is on for that day. At 9 a.m., we'll start calling for our inpatients to be booked, and they'll start coming down. And also around 9, our booked outpatients will start coming in, and they'll continue throughout the day until around 5:30-ish. So in terms of quantity, we can have anywhere from 70 to 80 outpatients booked per day. And then we also have orthopedic clinics and pre-op clinics that those clinics will send patients to us, which would have anywhere from 10 to 50 patients. And then we also have patients coming over from the ER, which is completely unpredictable. So with that, keep in mind we only have 3 rooms to do these exams and around 12 to 13 techs a day doing these patients, along with the OR cases, the fluoro exams, and the inpatients. So bottom line is we are busy. So why do I keep coming back every day? I'm so glad to. There's a couple reasons. So number one being that we get to work with technology and patients directly. So this is great for people who are people oriented, but also have a sciencey brain. So that's like overall, that's it for me. That's all I have. So the second best part is we're the eye of medicine, and doctors wouldn't really be able to diagnose a whole lot without MRTs. So I've compiled a couple examples of what we see on a daily basis. Top left, those are all the vessels in your brain. So that's highlighted with dye, and we take x-rays and we can see that. Super cool. To the right of that, this patient has a broken leg on one side and a dislocated hip on the other. So that's probably from like a trauma, car accident, something like that. Bottom left, you can see this person has swallowed a butter knife, probably somewhere in the esophagus, stomach area. To the right of that, this person has a pretty hefty brain bleed. So that's done with a CT scan. To the right of that is what a typical hip replacement would look like. And then at the very bottom right, it's actually a broken wrist. See those pretty often. We'll do the one above the wrist, and that's a collapsed lung, and you can actually see that there's a chest tube going in there to try and help this patient out, probably having some shortness of breath, so that should help. And then the one to the left of that, the spine there, that is a spinal tumor in the lumbar spine. So that's just a few things that we see every day, all the time, very typical. Definitely super cool part of my job. A couple more reasons. You're in control of your career and the path you take. Like I mentioned before, there's so many different areas you can go in. So if you want to change it up, you can. You also get to use a lot of your creative problem-solving skills to meet your patient's needs. Some patients would come in for an exam that you typically do standing, and they're quadriplegic per se, for example, and you have to adapt to those patients' needs to get the images that are required of you. And it's definitely safe to say that no 2 days are the same. Another reason imaging technology is advancing so fast, and that puts MRTs at the front and center of innovation. So like I showed you that CT scanner, brand new, it's fantastic. I think you can do a CT scan of someone's head in like 6 to 7 seconds. That's insane. That's crazy. Lastly, there are good employment opportunities in the province right now with the rapidly changing computer-enhanced technologies and the aging population, the increased demand for imaging services, and the demand in this field is expected to grow. So that's great news for us as well. So that is pretty much it for me. That's just a cute little video of how I would get gowned up to do an isolation case if we were going to go into COVID positive patient's room. So yeah, but that's it. So Tracy Hale has a quick video of the school. So she's going to show you guys that next.
Before Tracy starts, oh, we're on lots of mics, aren't we? I just want to say, Mackenzie, I was not lying when I said we're leaving the best for last. That was unbelievable. Thank you so much. So lovely to have somebody that can relate to the high school students. I'm getting emotional because that was so lovely. Thank you so much. I'm not going to take too much time because I want to hand it over to Tracy, and then we will say thank you from the whole team. But great job, wonderful job. And I know the students probably got a lot out of that. So over to you, Tracy.
Thank you, Mackenzie. I have no right to be, but I'm so proud of you. Seriously. I'm going to share my video. I'm hoping it will connect appropriately. I know the team at Horizon will help me out if not. So I'll just give this a shot here. See if I can get this connected. It's a bit loud at the start, I should tell you, because it was outside and it was noisy. So I did this with my students just the other day, and I can talk off the cuff about my profession, and they can make movies like nobody's business. So this is what we created in the run of about a half hour. So here it goes. Hi, I'm Tracy Hale, and I'm the Program Director at the Moncton Hospital School of Radiologic Technology. We're outside here in the hospital today, and we'll be showing you a little bit around our department to see exactly what our students do when they're here learning about radiography in the Bachelor of Health Sciences. Hi, we're inside the Moncton Hospital now, and we're just heading towards the Medical Imaging Department. It's our home of our X-ray school. You see here, it's also called radiology or X-ray patients. And I have a mask on now because we're still wearing masks in the hospital environment to protect ourselves and our patients while we're still going under COVID and the flu, all sorts of viruses. We're here in the medical imaging department now, and we're just looking at one of our third-year students. She's going up to go and do a portable X-ray in one of the units here in the hospital. Great, so now we're outside our X-ray classroom, which sits in the middle of the imaging department, so we are truly integrated into this environment. These students here are in their 4th year of the 4-year BHS program, so they are on the home stretch before they finish the program next May, so go in and meet them. Hello. Hello. These are 4th-year students. And they are doing a bit of studying. This is our classroom. We have a smart board. We have a lot of different items that help us with instruction. Our full-scale skeleton and our organ model. We have all of our past graduates here on our wall too with us, so it makes for an excellent learning environment and inspiration to know where we're going. From this room directly out into the different X-ray rooms to practice after each session that they learn here in class.
Hi, my name is Cassie, and I'm one of the 4th-year students here. I'm from Riverview, New Brunswick, and I'm hoping to work at the Moncton Hospital after I finish my courses.
Hi, my name is Brian. I'm a 4th-year student here in the Moncton Hospital School of Radiologic Technology. I'm from Miramichi, New Brunswick, and I'd like to return there to work in the MRI department after I'm graduated.
A little description about the structure of the program we call it integrated, which means you do 2 years at University of New Brunswick St. John, and then you do 2 years here at the Moncton Hospital program. And when you come here to Moncton, the program is fully integrated between didactic, which means in-class theory, and clinical, which means you get to practice working with the technologists on patients right away.
Hi, my name is Pam Henderson. I'm a didactic instructor with the Moncton Hospital School of Radiological Technology. And we are going to be demonstrating today how we go through a practicum lab following the theory of a lumbar spine examination. So what we're going to do is we have a patient on the table, and I'm going to be centering at the iliac crest. We open up our collimation. Fit for that. Okay, we make sure our patient is straight on the table, knees are bent, and head is on a pillow. Okay, take a big breath in, let it all out, and stop breathing there.
So I hope you've enjoyed this tour of our facility here at the Moncton Hospital and the Moncton Hospital School of Radiologic Technology.
There we go. There's our tour. Oh, I think I'm frozen. There we go. So yeah, Mackenzie and I are both here. I don't know if anybody has any questions for us about our program. It's we do have a lot of students that are from New Brunswick. We train them here in New Brunswick, and then a lot of them do stay in New Brunswick to begin their careers with Horizon Health Network or sometimes Vitalité. Or you can see Mackenzie, she's working at one of the chiropractic clinics as well.
Okay, so again, we definitely saved the best for last. I'm seeing some of the teachers that do have to leave because classes are changing. But I know that probably Jennifer might still have some students there. So I'm going to open up the floor. I always have 100 questions, but I am going to open it up to the students. So if any students have any questions for Mackenzie or Tracy, please feel free to join in the conversation. You don't have to put your camera on, but we'd love to hear from you.
Hi, Mackenzie and Tracy. This is Jennifer at St. Malachy's, and we really enjoyed the presentation. Really, really well done. And we don't have any specific questions. I think you covered so well what the day-to-day of it looks like. Mackenzie, it just, you walked us through it. So it was really fantastic. And thank you very much for the presentation. I don't have anything I need to ask. I guess maybe Mackenzie, I would say, I guess it's from me, what did you find the most challenging part? I mean, you really stuck with it, and that was admirable that, you had to go back and get those courses. What did you find challenging about that?
I guess it would just be persevering through it all. Sometimes you get to this point where you're like, is this really for me? Is this life telling me to turn around? But it was just something that I resonated with throughout the entire process. And the whole time I was just thinking, this is the end goal. Ultimately, I want to be working in a hospital with patients and be able to learn all these new things about technology that, you wouldn't even think about on a day-to-day. So I think the hardest part was probably just following through with everything, but ultimately it definitely paid off, and I'm so fortunate to be where I am today and having great instructors like Tracy to help support me throughout the whole time. It's great.
I'm getting teary-eyed with you because Tracy, you just must be so proud of Mackenzie, and your maturity and articulation is just so beautiful. And if anybody has any other questions, certainly Miss McKinnon's there. Natalie, if your students have any questions, please feel free to jump in. I know that they may be moving about, but I'll just leave the floor open just for a couple more minutes.
I did put my name and email address there. Acceptance rate. Okay, the acceptance rate. We actually we've kind of hit a sweet spot with people that are interested in this field. It's not as large a field as nursing. So we generally have about 15 applicants to the program each year from UNBSJ that are in their first year for the 2 programs within Horizon. So we're really moving towards having 1 school for the radiography programs with 2 sites, Moncton and St. John's site. So we do both accept 6 to 7 students per year. So it's unusual for you if you're in the program, you want to get in, you're doing well at UNB that first year, and we do interview to ensure that we have good selection as far as a fit for the field. We want to make sure you investigated it appropriately. And so if we do have 1 or 2 per year that don't get in, usually they will, well, not like this Mackenzie, but maybe for her high school, she stuck it out. They will stick it out at UNBSJ, do a few more courses, and they will reapply the next year. I do have an example of a student I know that did gain entry the second year they applied. So it's actually excellent rates. If you're interested, you're pursuing it, you do well, you're I won't say guaranteed a spot, but it's very high likelihood you'll get in.
There's another question from Jennifer, I think.
Hi, I have a student who has a question.
Perfect.
What's the most weirdest thing you've ever seen as like an image?
Oh, goodness. Good question.
Tracy, do you have an answer? I got some pretty weird things, but
Yeah,
I don't know.
we do see some very unusual things, and I guess we wouldn't want to say too much sometimes because there are some confidentiality issues there. But if people can ingest or put in things into their body, they do find a way to do that a lot of times. And unfortunately, we do see that, and then they have to go for surgery for corrections there. So we do see some odd things by times. And we do have to really, our focus there is to maintain the dignity of that patient for whatever they've experienced, whether it's something that has occurred to them or whether they have some mental health issues that go along with having some of these issues in imaging.
Perfect. And there's another question here. It says, Mackenzie, what would you say are the most important qualities to have to be successful as an MI professional?
That's a great question. Big one would be that you really have to be not a people person, but just have a little bit of empathy for your patients, and know where they're coming from. It's easy to forget that when your patients come into the X-ray department, a lot of them are scared and nervous and just have so many questions that are looking for an answer. And a really important thing that my teacher taught me, Pam, was just to always treat your patient as if they're your first patient of the day. So, you could see about 50 patients a day. Doesn't matter. You still have to treat them as if they're your first, because you never know what they're going through. So just be able to feel for those patients. And again, it's more science than I had originally anticipated, but there is a lot of physics involved that Tracy has taught me, and it really brings the uniqueness to the profession. Like I mentioned before, the patient care and science together. But yeah, I'd say that's that.
I'm just being mindful of time. Oh.
Deneen, I'd like to just throw this in there before we get off the
Yes.
call. If there is a student watching now or watching this as a recording in the future and you're interested in doing a job shadow or learning more about the profession, I did drop a link into the chat that goes right to our education placement website where you can request a job shadow and we can either coordinate an in-person job shadow or coordinate some sort of virtual connection with somebody from Horizon Health who you can chat more with.
Awesome. Thank you, Morgan. I don't see any more questions in the chat, and that means it is the end of our Allied Health Week, which is so exciting. And again, I don't think we could have closed with a better presentation. So beautiful, so thankful. Mackenzie, I think you have a future in teaching, if I can say that. Tracy, you should be very proud of this young lady, and I know that New Brunswick is very proud of you, Mackenzie. So thank you so much for helping to educate the students of the province and kind of share your career pathway, and your resiliency and your hard working and your determination paid off. And it's just beautiful to see. I get shivers just kind of listening. So, and Tracy, thank you for being a beautiful leader, obviously, in your profession. We extremely appreciate you. Morgan, same thing. Thank you to Horizon Health for being part of the week. I am going to ask my beautiful intern B to put on her camera. She's been behind the scenes this whole week. Thank you so much, V. And with that, from the Department of Education and the Center of Excellence for Health, my name is Deneen Diamond. Super excited to close today, but kind of sad that we're not going to be offering more sessions next week, but Allied Health Week will be around every year, and we look forward to next year. So have a beautiful day, happy Friday, and signing off from the Center of Excellence for Health.